so this is chapter 20, and chapter 20 covers blood vessels and blood pressure. So you're going to go over the anatomy in lab, so you'll go over the basic structure of the vessels, and you'll also go over where the locations of them are in the body. Okay, so to go back to review, okay, the general flow of blood through the body. Okay, so if we start at the heart, we'll go to the arteries, and then we're going to go to arterioles. Okay, so arterioles are like baby arteries. From there, we're going to go to capillaries, and that's where gas exchange will take place. Then the blood's going to return to the heart through venules, and then veins, and then it'll be back to the heart. So remember, typically this blood is oxygen rich, okay, and this blood is oxygen poor. Normally, there are some exceptions to that, but usually this is oxygen poor and the other is oxygen rich. So we represent the oxygen poor as blue and the oxygen rich as red. Okay, so if we look, if we look at this structure, okay, I want you to remember the best way to remember arteries and veins. So arteries are going to carry blood away from the heart, so that's an A and an A. And then veins are going to carry blood back to the heart. So veins also have valves, and arteries don't have valves. The valves are going to prevent backflow, and we'll talk about that in a minute. Okay, so this is showing you a representative artery and a representative vein. You're going to notice that veins are normally very floppy. Okay, so they're big. They have the layers in them are not as thick, so they're floppy. They have less tension in them, whereas arteries have a thick layer called the tunica media, and the tunica media that's where the muscle is, and it makes an artery very firm. Okay, so if we go over the layers, I have this on the next slide, but tunica intima is going to be the innermost layer, tunica media is the middle, and then tunica externa is this outermost layer. Okay, now sometimes vessels are so big they have their own blood supply, and that's called vasa vasorum, which we'll talk about in a minute. Okay, so they call the layers of the vessels tunics. Okay, so the layers are tunics. The hole in the middle, so here, the hole in the middle, that's the lumen, and that's where the blood's going to be. Okay, I should have made that red, but I didn't. So the hole in the middle is the lumen, and that's where the blood is. Okay, so there's three tunics. So tunica intima is the innermost layer. So I always say, like, think of underwear, which is intimate apparel. Okay, so its epithelium is made, or its endothelium is made of simple squamous cells. So it's very thin, it's very, they're touching. So what it's doing is making a very smooth surface for the blood to flow over. Okay, so it's just gonna flow right over top of it. Okay, now the tunica media is the middle layer, and that varies in thickness depending on whether it's an artery or a vein. They're usually composed of smooth muscle cells. It's going to be where we can actually regulate blood flow because they constrict and dilate. Okay, so veins don't have this much smooth muscle, so veins are floppy. So if you had to draw a vein, the vein would look like this, and an artery would look like this. So veins are big and floppy. Okay, the tunica externa is the outermost layer. They used to call it tunica adventitia, but what it is it's areolar tissue. So if you remember, areolar tissue is very loose and kind of fluffy and connected. It's going to allow the blood vessels to be anchored into the body so that they're like attached to something. They're not just flapping it around. Some really big vessels have their own blood supply, and those little vessels feeding the tunica externa are called the vasovassorum. Okay, so I think that's it. All right, now this chart is a nice table from the book, and it compares arteries and veins. It puts it all in one nice place all together. So arteries have a narrow lumen, veins have a wide one. Arteries are thick, veins are thin. Okay, veins tend to be floppy, and it just kind of goes over everything that we're going to talk about, and it kind of is logical, but I like the way that it was organized in this table. Okay, now, what's going to happen is when the arteries and veins are flowing in your body, they're not a uniform size all the way through. Okay, so that the size is changing as we go from one place to the other. So next to your heart, they're going to be big. Okay, so they'll be big, but then as you go to your extremities, okay, and you go to capillaries, they're going to get thinner. Okay, so we're going to progress from elastic to muscular to arterial down to capillary, and then we'll go back to a venule, to a medium-sized vein, and to a large vein, and then back to the heart. So the progression kind of works like this, and that, I think that makes sense. That's kind of logical. Okay, now, one thing I want you to see on this picture is the two different kinds of arteries that we have. So we have elastic arteries and we have muscular arteries. Elastic arteries are arteries that are really close to the heart, so like the aorta, the pulmonary trunks. But what they do, okay, they have to have more elastic tissue in them, because when the heart beats, a whole bunch of blood is going to come being forced through these, so the pressure is going to be really high. So they have to be able to stretch and come back. So that's important. If they can't do that, that's bad. That's not good. Okay, now muscular arteries are also called distributing arteries, and what they're going to do is they can vasoconstrict or vasodilate, and I have this on the next slide. So the size of them can change, so they can open and close the hole, okay, and control blood flow. Another thing I wanted you to notice on this picture is that the veins have valves. So the purpose of the valves, purpose of the valves is to prevent backflow of blood. We want the blood to be going in one direction. We don't want it to be like sinking to your feet every time you stand up. And we'll talk about that more. Okay, so first we're going to start with arteries. So arteries, they're low resistance conduits, okay? And so that means they're tubes, and there's not a lot of resistance in them. Okay, their job is to move blood away from the heart. Okay, the structure is they have a thick media, tunica media, and they have a thin externa. So here this is kind of redundant, but the conducting arteries are the elastic ones, so they're largest and closest to the heart. So because they have elastic fibers in them, they're going to be able to expand when the blood's ejected from the heart. But so like when the heart contracts or is in systole, okay, they're going to stretch. And then when the heart is in diastole, they're going to come back to normal. Okay, so examples of these conducting arteries are the aorta, brachiocephalic, which is, you don't know yet, okay, but it's going to go down your arm or at the head of your shoulder. Subclavian, which is around your clavicle, and then the common iliac, which is kind of like in your groin. Okay, so they're bigger. Okay, so muscular arteries, they're further away from the heart. Okay, so they can vasoconstrict and vasodilate, and they're going to regulate blood flow. So vasoconstrict means the lumen size is going to get smaller. So when that gets smaller, blood flow slows down. Okay, so if it's like squeezing a straw. If this gets smaller, less blood can flow through there. If something vasodilates, okay, the hole gets bigger, more blood can go through. Examples of those are brachial, coronary, anterior, tibial. Okay, there's a lot of other arteries and arterioles that are smaller. Most of the time, what we're naming these conducting and muscular arteries. We don't bother with the smaller ones, especially in this class. Okay, so we're going to learn to name them in the lab. Even though there's a whole big section in your textbook about naming, we're going to, you'll use that for lab. We don't do it in lecture. Okay, now, the smallest kind of arteries are called arterioles. Okay, so they're like baby arteries. And I always say in anatomy, the smaller the part, or the smaller the structure, the longer the word. Okay, so arterioles, we don't name them. Okay, they're little. So they have really thin tunica medias. They just have about 6 layers of smooth muscle. Usually what's in there is slightly contracted so that there's some tone in the vessels so the arterioles aren't floppy. They're going to be regulated by the vasomotor center in your brain, which we'll talk about. Okay, and they can regulate blood flow to the different parts of your body depending on what's going on. Okay, so here I have 2 like generic scenarios. So one is this guy is sitting, let's say he's resting and digesting. Okay, so his blood vessels will reduce flow or constrict going to his legs, but increase flow to his digestive system so he can digest his food. In this one, the people are playing soccer, so the vessels to the GI tract will constrict, while blood flow will be increased to the cardiac muscle and the skeletal muscle. So muscular arteries regulate flow. And I'm going to stop here, and then we'll pick up here.